how to take care of your skin after a halo. Okay, today's the day. I got my halo. What do I do now? Well, for the next 3 hours, thermal spring water is going to be my best friend. I'm going to spray my face as much as I want. If you want just to be cautious, you can buy an additional thermal spring water. This kit comes with a travel size one. Some patients feel that it's necessary to buy an extra one. Most patients that I've had on average only need what comes in the kit, which is the travel size. If you want some for that week to deal with dryness, then definitely get an extra one. It's $14 and well worth the insurance of having that extra bottle. So here's the Avin SOS recovery kit that I give my halo patients. Like I said, you will get this thermal spring water, which is travel size. You can use it as much as you want. You will also get a little baby cleanser. Don't need to wash your face right away. You may want to wash it that night. Depending what time of day you did the halo, I'll let you know, but say you did it at 9 o'clock this morning, I want you to wash your face tonight. So say tonight rolls around, it's 9 p.m., I'm about ready for bed. Cleanse with this. It's a little tiny, you do not need much. This is called the Extremely Gentle Cleanser. Avin actually markets it as a non-rinsing cleanser. I think you should still rinse it personally, but you could just wipe it off. And they claim that's enough to clean your skin. I just cannot deal with the thought of not rinsing it off, so I rinse it off personally. Then apply your sickle fate cream. You can also use this sheet mask. I'm gonna be honest, it's gonna be a little steamy that same day, so you could even save it for the next day. Honestly, it's more about preference if you want to use it that day or the day after. But it helps reduce redness, it gives hydration to the skin, it's calming, but it does sting when you first put it on. So depending how sensitive your skin is, you can kind of decide. But definitely use the Sickle Fate cream. That keeps it hydrated. That helps with the burn, it helps soothe it, it helps heal it faster. If you are acne prone and get acne very easily, you would do better with Aquaphor versus the Sickle Fate, because this does seem to clog people's pores who are very acne prone. It may be safe to use for a day or two, but you are going to be high risk for having a lot of breakouts if you keep using a thick cream like this when you're acne prone. The majority of my patients have drier skin. They're actually typically in that 60s age group, and they have very dry skin, so they do very well with the Sickle Fate. But someone my age and younger who maybe is more acne prone and more oily skin, they would do better with Aquaphor. It also comes with a little packet of sunscreen, probably only enough for 1 or 2 days. But this is the kit that I give my patients. Like I said, today I got treated, or pretending. Tonight I'm gonna sleep propped up. So if I have a recliner, that's gonna be the best place for me to sleep propped up. That's gonna keep my face from swelling too much, assuming we treated my face. In this case, we did. So I'm gonna sleep propped up. That way I don't smush my face into a pillow, because that's gonna cause swelling right there. It's gonna cause irritation. That's unnecessary. You wanna sleep on your back, propped up, and that's gonna decrease swelling. You can take Arnica like I did. Again, you can watch that video. I show my day-to-day routine as I'm healing. I took Arnica. You can take Claritin, you can take Zyrtec, you can Benadryl if you are not allergic to those things, obviously, and have taken them in the past and do well with them. Then you can take them to decrease swelling, cut down on your inflammation quite a bit by taking antihistamines. the first couple of days especially. I always tell patients, if you look a little chipmunky like I was showing you with your big cheeks and overdone lips, you're doing fine. If you're not Asian, but you look Asian the next day, you need to contact me immediately. Because that is not really what I'm looking for, and you may need a steroid to deal with the swelling that occurred. So I like to know I have that much swelling. That's why I love to check in with patients the very next day. How are you doing? And they always want to send me a selfie. I always tell them I love sneak peeks. And that way I can make sure that, okay, everything looks normal. Everything looks fine and great. Awesome. I don't want someone going to the ER when it was totally unnecessary. I want them to go to the ER, period. And a lot of times if I know that, hey, you look Asian when you're not, because you're so swollen and it's unusual, I can call one of my doctors and they're going to I'm going to tell them your pharmacy, your date of birth, all that, and they're going to call you in something like a steroid that's going to help with that, most likely prednisone, assuming it doesn't interfere with your other medications, which is why it's great for me to work for doctors, because I can't prescribe you medication, but they can. Just stick to your informative sheet that I'm going to give you. Sleep propped up. Don't wear makeup. Yeah, those are the big ones. Keep your face clean, hydrated. Don't go work out the next day. Don't work out for at least 2 days. You want to be super cautious. 4 days. Walk. Just low impact exercising. Don't go run a marathon. Don't go hardcore workout and have sweat dripping off your face. Don't jump into a lake. Don't jump into a pool. That's high risk for infection and problems. So, okay, I'm waking up. It's day 2. I just cleanse my skin gently. I put moisturizer on very gently. I use the Sickle Fate or Aquaphor, whatever your provider tells you. I wear sunscreen if I'm going to be out or next to a window too much. Most people are staying indoors. They're hiding from everyone, so they probably don't need to do all that. Probably just need to cleanse and moisturize it. And then moisturize throughout the day because you're going to feel super dry if you don't. Use your thermal spring water as much as you need to. Day 3 rolls around. I'm still hydrate. Honestly, it's going to be the same thing for the next several days for at least a week. Until my skin is not peeling and dry, I'm going to keep using gentle stuff. Do not use tretinoin. Do not use retinol. Do not use glycolic acid, salicylic acid until you are fully healed. If you're not sure you're fully healed, you're probably not. Always check with your provider just to be safe if you're not sure. But like I said, if you have to question it, you're probably not healed yet. Your skin should just look nice, glowy, and not peeling off, not red, not irritated if it is healed. You need to get your skin hydrated and healed before you start adding in actives like vitamin C, tretinoin, retinol, all those sorts of things, because you're going to irritate the heck out of your skin and can cause some unnecessary problems. Do not use liquid foundation when you are still healing and peeling and all that. Please do not do that. You're going to be high risk for infection, and it's not even going to look good. It's just going to look horrible. Your skin is so dry and coming off that it's just, the makeup's going to stick right to it, and it's just not going to be a good look, and it's just an unnecessary risk. I had one lady do that anyway. I had her do it like day 3 because she went to work, and I mean, I say this until I'm blue in the face to people. Don't do X, Y, and Z. I give them a sheet that says don't do X, Y, and Z. I give them a sheet of what to do. I tell them what to do at least 2 or 3 times before they leave, and guess what? She still wore makeup. And guess who had to get an antibiotic and a steroid? That person. So she gave herself unnecessary risk. She got an infection. She had significant swelling for much longer than she should have. She created more problems for herself. And if you're watching, I'm not saying that to embarrass you. I'm saying it because I don't want other people to have problems that are unnecessary. It's just not fun. It's not fun for the patient. It's not fun for us to get those phone calls and pictures emailed to us or text to us, and then we're like, oh, it's definitely infected. So don't do that to yourself or your provider. Wait until it's completely clear, smooth, and healed. Hope you found this helpful. If you have any additional questions, please comment down below. And I hope to see you soon. Thanks so much. Bye.